Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. So today I'm going to be demystifying a designer Gallagher nipples and talking about how we masculinize a nipple for masculoplasty. So first things first, we got to pay attention to details, because obviously the male nipple is very different from the female nipple. It's smaller, the areola tends to be oval in shape, not circular. The papilla, the little part that sticks out a lot less. So in general, when a patient asks me to masculinize their chest, I'll stick with the known dimensions for what is a typical masculine nipple. And obviously this depends on the individual patient, because in fact the diameter of the nipple, it's been studied, depends on the diameter of the chest. So a smaller guy will have a smaller nipple, a larger guy will have a larger nipple. But at the end of the day, it really depends on the patient's preferences. And I certainly have patients who will bring pictures and say, I want small nipples, and we can absolutely accommodate that, or a little bit larger, or whatever is most affirming to the patient. So the real secret behind getting that very natural masculine look is we actually deconstruct the nipple itself. We don't just take the nipple off and put it back on again. What we do is we kind of take full control of the look of that nipple. And how I do that is, initially, the first step of the surgery is we're going to design the areola. So we're going to go with an oval shape and just take some of the original areola skin. I usually try to dodge the little Montgomery glands, which are the little bumps you get on there, as some patients don't really like them to be transferred over, and they usually will come with the graft. So first things first, we will design that usually about 22 millimeters at maximum dimension in an oval shape. So we'll harvest that, take it off, and it goes to one side, and we're going to thin that a little bit so it takes very nicely as a skin graft. The next step is we'll turn our attention to the nipple itself, the little part that sticks out, or the papilla. And so we're not going to take the entire papilla, we only need a little bit of it. In some cases, we're talking 25 to 50% of that. So what we'll do is we'll harvest a little chunk of that, or as I like to call it, our wee little chunkies. So we'll take a couple of wee little chunkies, and again, they go on the back table, and we're going to come back later and choose our favorites and obviously match them up as best as we can. So fast forward to towards the end of the case, we've done our masculoplasty, we've marked where our future nipples are going to live. The next step is to graft that nipple back on again. So first thing we'll do is graft the areola itself back on, and it has been thinned on the back table, and so it goes on and gets sutured into position. Usually I'll use a special type of silk suture, which will also hold our bolster later on. So it will go into position, and then following that, through a little hole in the center, we'll graft our wee little chunky, or our papilla, back on. And this goes on with a different type of dissolvable suture, which will stay in place. And then once it's grafted into position, we're going to wrap it up and put our bolster on it, which is going to stay on for about 3 days. So there you have it. That is the secret behind Gallagher designer nipples. And in some cases, we can leave the original nipple intact. If a patient has a very masculine nipple to begin with, we can certainly just leave that alone and take it as a graft altogether. But in general, probably 95% of the time, this is how we design them and make them.